Chronically ill person who has ADHD, there's nothing worse than having to deal with the bureaucracy of the healthcare system in the United States. And this is a celebratory video because I saw my PCP back in early June, and I was very terrified to tell her all the things that have been going on with me this year, all the referrals that I needed. And since then, I have now, as of today, just spent 3 hours on the phone getting all these things scheduled, gotten pretty much everything scheduled except for 2 things. I already went and saw the ENT, made a video about that. They called me a week ago saying they were worried that my insurance wouldn't cover the sinus CT they want me to have done. So I put that off for a little bit, dealing with, because I was very stressed out about it. But then today I went to the dermatologist, got medication to put on my face for my rosacea and cystic acne that's reemerging since I had to get off the medication I'd been on for hormonal cystic acne because it was causing dysautonomia. And also, she said that my hair loss has stopped. So that's great too. Who knows when I cut my dose some more on that medication if I will continue to lose hair on the side here. But she said for now that the hair loss seems to be like completely normal. She did tug tests. She didn't see any signs of continuing thinning, but she did say that it did seem like it had thinned here. So that was nice to have that validation. Also, sorry, my dogs are deciding that this is the time to play right on top of me. But anyways, I got home and I felt motivated. And if you have ADHD, you know that when you feel motivated, you just got to do the things when the motivation strikes, okay? So I started doing all the things. I decided, you know what? I'm going to call my health insurance to see if they're going to cover that sinus CT. So I get on the phone with my health insurance agent, and she's actually very nice. I was relieved. And she was like, I need the billing code information. Like, I can't really check any of this until I have that. So then she's like, do you want a 3-way call your doctor? And I was like, this has never been offered to me. Absolutely. Oh my God. Can you guys not do this on top of me? Literally, this is the worst possible time. They've been sitting here calmly for the past 30 minutes on my lap while I've been doing these phone calls. So of course now it's time to attack each other. Anyway, so we're on this 3-way call. The person is able to give her the billing code as well as like the diagnostic code for my chronic sinus infections. And they're like, yeah, I don't know why they thought that this wouldn't be covered. This is absolutely covered. It's just like a HUD CT without contrast, which is like a common thing to get. It will be absolutely covered. So that was nice, a relief, because I have that appointment in less than a month. And then I'm like, I'm still feeling motivated. We're going to get all these different things figured out that I still haven't gotten scheduled. So I get on the phone about a colonoscopy because I really do need a colonoscopy. I've had blood in my stool off and on for a year, and you know that the colon cancer rates are lowering in age. So when I told my doctor, my PCP, this, she was pissed, first of all, that my GI did not schedule me a colonoscopy and referred me one. I got a call from the nurse about a week ago saying, like, checking to see if I'd heard back, and I said no, I hadn't, and she found that the colonoscopy order had been put in, but it had been put in as inactive for a reason that she did not understand. So she switched it to active, told me I should hear from them in the next couple of days. Didn't hear from them. So I called them several times last week, and every time I called them, they said they didn't have an order, and that I should stop calling, basically, because I was harassing them, and that I should wait until I got a text. Well, I was over that, so I called again today. I got this wonderful angel of a woman, Mary. Thank you. Mary, if you somehow see this, bless you. She's like, that's not true. We can look in the notes and see if the doctor put this in the note. And if it's in the notes, then we can schedule an appointment for you. Because I explained what was happening and my anxiety about like colon cancer and all that. And she looked through the notes. It was in the notes. They could have scheduled me from the very beginning. And so I got that scheduled August 12th. I'm terrified, very anxious. It's a Monday, which means I would be having to be doing colonoscopy prep that weekend, but it's okay. I'm just relieved to have it on the books, but also terrified. I also already had my appointment scheduled for the cardiologist, which has been long-standing, needed, and it's not next week, but the week after that, so that's good. I'd also been playing phone tag with the allergist for the past week, and so I decided to just keep calling them over and over and over again once I got the colonoscopy thing figured out, and it took like literally 17 calls. I kid you not, we've called each other back and forth. Like, they called me back from leaving a voicemail while I was on the phone with the colonoscopy scheduling people 15 times. That's how many times we've gone back and forth trying to get a hold of each other. So I called them so many times, and finally they answered. I was able to get that scheduled, so that's great. That's sometime in July, actually maybe also in August, I don't know, but it's July, August, one of the things, so it's coming up. And then the last thing is, well, physical therapy, which I just need to keep calling them over and over again to get things scheduled. But the lady at the front desk scares me. I've been to this office before, which is why I'm putting that off. That's going to be a task for tomorrow. Hold me accountable in the comments. I will get physical therapy scheduled. I need to freaking do it for my joints. But then the last thing actually is the geneticist. And I was nervous about the geneticist because I've heard things about them having massive wait lists. I was stressed out about it. And so I called my PCP's office because they told me if I hadn't heard back in a week to let them know. So I call them, I get a hold of them, and like the front office, they go talk to the nurse, and the nurse is like, yeah, they said that they got the referral, but I'm on the wait list. And so then they're like, you can call the scheduling phone number and they can try to find a different location for you, because I go to a network of hospitals, and I guess they're trying to get me at the one that I like go to for my PCP, which is not the most ideal one for me at all, because it's really not close to me whatsoever. There's several hospitals closer. So they gave me the scheduling phone number. So I call the scheduling phone number. Also, I should add, waiting to schedule my colonoscopy, I was on hold for 23 minutes just waiting to schedule it. So I got home from my dermatology appointment at 2 p.m. It's 4:30. I just finished everything for scheduling right now. So I'm on the phone, on hold for 10 minutes with the scheduling people just in general, waiting. The call terminates randomly. I don't know why. Great. So I get on another call. This time they pick up after about 5 minutes, and the lady starts laughing. She's like, we don't schedule genetics here. I think they gave you the wrong phone number. And I was like, probably. It was the front desk lady. She seemed frazzled, didn't likely know what she was doing. So she gave me the phone number, but she also was like, let me patch you into them. Perfect. Even better. Thank you. So she patches me in. They answer almost immediately, and she already had given them a rundown about me. And they're like, oh, yeah, we just need to complete this information for your intake to be able to do the referral, which is why you were waitlisted. And I'm like, that would have been great to know sooner, but okay. So I give her all the information. She's like, perfect. You should hear back from us in under 2 business days. You should hear back from us to schedule the appointment. Yes! That means I'm going to be scheduled for a genetics appointment, hopefully sometime in the near future, to get my Ehlers-Danlos diagnosis. And if not that, some other connective tissue disorder, because baby, I got shit going on and we don't know what it is yet. But what I will say is that I didn't know this. My doctor, my PCP, did already put on my chart hypermobile Ehlers-Danlos syndrome. Bless her. She really is a gem. To all you who are telling me I should switch doctors because I have no contact with my mom and she works in that office, you guys just don't understand what it's like to be chronically ill and try to get all your health stuff figured out, especially when you have a connective tissue disorder that affects all of your body. You need somebody who's knowledgeable. So yay for me. I'm so proud of myself. Like I said, I was literally on the phone for 2.5 hours trying to get all this stuff scheduled. Tomorrow, my goal is to get my stuff figured out for my physical therapy. Fingers crossed. Again, hold me accountable in the comments to make sure I do it, but this is it's yay. Like every doctor I've been to that I've been referred to for everything besides the GI guy a while back, I don't like him. Don't worry. I scheduled my colonoscopy with a different doctor that's not him, who I got a recommendation from someone on here. So thank you, fellow EDSers who live in my area. Bless you for your recommendations. So I got it scheduled with that guy. And I'm just so proud of myself that I have been navigating. It's felt like a full-time job. I'm not gonna lie. It's felt like a full-time job on top of my full-time job and also doing TikTok. But we're getting it figured out. We're getting everything scheduled. Every doctor has been just wonderful, mainly because I've requested all women. Those male doctors, most of them are ops. It's like they don't want to help you. They aggressively don't want to help you. But anyways, all that to say, I'm so happy that I started talking about this on here because it's finally given me the motivation to do the stuff and update everybody about it. And finally figure my health out, because I've been miserable and I've been in so much pain, and I just kept telling myself it didn't matter, but it does matter. And I want to thank you all for giving me the motivation and the support and everything to get this all figured out. And I finally feel like a weight lifted. Yes, having an Ehlers-Danlos syndrome diagnosis doesn't change anything necessarily, and there's no cure. It's a genetic disorder. It just means managing symptoms, but having that on your chart really helps. It really helps everything. It helps doctors, when you see other specialists, understand what could be going on with you. It makes it so they don't rule things out so quickly that are rare, because what did my GI doctor say? Treat everyone like a horse rather than assuming they're a zebra. Well, I am a fucking zebra, dude. So you gotta assume I'm a zebra because I'm special here. But anyways, all that to say, things are looking up for me. Fingers crossed they keep going this way. And I will update you all as I continue to go through all of this, especially the colonoscopy stuff. So that's in August 12th. Drop your colonoscopy tips in the comments, please, especially all of you with Ehlers-Danlos syndrome. I am terrified, absolutely terrified. Really scared that the anesthesia is not going to work. I'm going to wake up during surgery, but that's for another video.